Worm eggs are passed out from the human feces of infected persons and grow on soil and in water when feces are left out in the open. The three most common soil-transmitted worms affecting children are roundworms, whipworms, and hookworms. In the first two cases, children are infested when they eat unwashed foods grown on soil contaminated by worm eggs. Children are infested with hookworm when they walk barefooted and the larvae on soil burrows into their skin. The news team visited some schools in the eastern regional capital, Koforidua, where about 75,000 pupils from all 26 districts in the region from kindergarten 2 to GHS 3 are expected to be attended to.
It is very important for the children to get the drug. One, if the children continue to have a series of infection, it will even impede their delivery. The men will not be able to impregnate their wives in the future. These ladies will also not get pregnant in the future. So generation will be going down.
In the eastern region, activities such as galamsey make children more susceptible to worm infestations. But in an interview with Christian Fiado, focal person of neglected tropical diseases in the eastern region, he states that OPD cases of infestations such as bilharzia have significantly reduced after the ban on illegal mining. But there is more that needs to be done.
There is a reduction in all the cases, but we think that we can do more. If every child take the drugs, we educate the children not to go back to swim or to wade into the waters. We know that by next year or a year by now, that we will continue to reduce. The cases will continue to reduce.
Proziquantel for schistomiasis as well as albendazole for other intestinal worms are the dewormers being administered to the school children by teachers who underwent some training on dosages and methods of administering the drugs in the weeks leading up to the exercise. Joyce Aye, National Campaign Ambassador for Neglected Tropical Diseases, has alluded to the fact that a lot more public education on worm infestations should be done to significantly reduce the rate.
We need to make sure that the schools completely understand why the mass drug administration is done. It's about health. Maybe today they may not feel anything, but in a month's time, if they have not been properly medicated, they'll come down with some of these intestinal worms or even bilharzia.
Research has shown that regular deworming can substantially increase primary school attendance and significantly improve a child's ability to learn in school. However, positive hygiene practices are essential for the prevention of worm infestations.